Hi, I'm Steve Parker, founder and CEO of The Profitable Dentist.
And I'm Gary Cady, founder and CEO of Next Level Practice.
Together, we have over 50 years of experience helping dental practices overcome hurdles and achieve the success they deserve.
We wanted to speak with successful dentists to see what problems they faced and how they overcame them.
So we're teaming up for a road trip across America to showcase practices that have set the bar for excellence.
Join us as we go behind the mask. Today we're visiting the Heart Attack and Stroke Prevention Center of Central Ohio. Dentist Dr. Barbara McClatchie and her husband, cardiologist Dr. Eric Goulder, are running the first successful medical dental practice in the country. We want to hear their journey from concept to creation and understand what they've overcome in their path to prosperity.
Let's do it. Let's go meet Dr. Barb and Dr. Eric.
You got it.
Let's get behind the mask.
You bet. Today we're going to see a business model, a successful business model, two successful practitioners, a medical practitioner, a dental practitioner under one roof. And so I'm so excited to have you see this thing.
It's going to be cool.
amazing.
I can't wait.
Let's do it. Hey, how are you? Good to see you.
Eric, good to see you again, my mate. Yeah?
Yes, good to see you, Eric.
Good to see you.
I'm a hugger.
We made it to Worthington.
I'm
Good to see you too.
I can't wait
Glad
for
to
you
be
come
here.
in.
This
Glad
is
to be here.
beautiful.
Thanks for having us.
Thank
Yeah.
you so much.
You bet.
Come on in.
Let's do it. Steve,
We're here.
we made it.
So, Gary, I know you've been working with Barb and Eric for some time now, and this is probably a little bit different than any other client that you have, and it is. I mean, they're the only practice in the country, as far as I know, that literally combines medical and dental under one roof. So, if we can, what I'd like to do, looking at it from my perspective, sort of as the industry goes, get started with, figuring out their challenges, the solutions, the things they've overcome, and, really move into the nuts and bolts of what they've accomplished.
You bet. And the interesting thing is, dentists don't always think that medical doctors have honor and respect for them. I had a room full of doctors and dentists in the same room, and they're in awe of how they have the freedom to run a business.
Right.
And it's so interesting that we have one here. So I'm so excited to be here today and really have your story be captured in a mini documentary, because this is the future of how dentistry and medicine are going to be working, and you're the first to do it. So first, incredible courage, incredible will, determination, and vision for creating what you've created here. So thank you for doing that.
Thank you.
Yeah.
Thanks for inviting us in.
Yeah. So we're going to get behind the mask today, and what we're going to unfold is the 9,999 ways not to build a medical dental practice. So also, thank you for taking all the hits on this thing. You didn't have to do that, and I can't wait for I can't wait for the viewer to really get a sense of what's possible here for all people. So let's start with Barb. Barb, I met you and you were a sole practitioner. And let's talk about when we met and what triggered this whole vision, because we all know that when a woman sees, a woman points, a man leads, a woman follows. So the guys who get that, my friends who I tell it to, they don't get it, and then they have problems, Steve. You know what I mean? But you pointed, and let's go back to that moment. Take me back to your dental practice.
Well, I was a hygienist before I was a dentist, so I was providing preventive care back in the 80s. And I've always had an interest of the oral systemic connection, but didn't really know much about it. But that was just an interest of mine, and a dental sales rep came in with a flyer saying, I think you would really enjoy hearing the speaker, Gary Cady. And I didn't know who Gary Cady was, sorry. But she said, I really think you should go. It's right up your alley of what your interest is. And so I went with a couple teammates, and I heard you, met you, heard your story. You were very entertaining. You were teaching us lessons. You were showing us what could be possible. And you were talking about next level and coaching opportunities. And as you know now, I'm a very methodical, have to have all the answers before I make a decision. But for some reason, and I know you remember this when we met, is after the course was over, we had a one-on-one time, and I expressed my interest in the oral systemic connection and what you could offer. And I just looked into your eyes, and you were such a caring, genuine, non-salesy kind of guy that I just connected with you, and I felt you were really going to help me and elevate me in my journey. And I just said, I'm in. And I just looked at my teammate and said, what did I just do? I have no idea who this is. I haven't researched the program, but I have this great vibe with working with you. And that's where our journey started.
Well, what a great story, you know. And I just had this experience of this spunky, like passionate dentist who had this picture of what was possible for our industry, and we matched up, and that's what it was. It was like we matched up in
It's
pictures.
like 11 years now.
That's insane.
I know.
That is insane. So I'm grateful for your courage to step into that, because you know, I remember our 1 month together and how I learned about your past and what your home life is and what your picture is of an ideal scene. But it wasn't this, right? This is well past your wildest dream.
No, there was no vision of that at that time.
Yeah, so it's sort of like Columbus, you know, he sees the horizon, then there's a new horizon and a new horizon and a new horizon. And let's start unpacking that. Let's talk about the turning point for you. When did you get this, like, now you get some foundation, we're working together, you get this foundation, and then what happened? What started elevating this turn to this experience that we're in today?
One of my hygienists introduced me to saliva testing, oral DNA saliva testing, and she does a lot of research, more so than I do, and so she brought that education into me, and we started with the team and started saliva testing, learning what it meant, and just dabbled in it a little bit. And then we went to the founding meeting of AASH, which is American Academy of Oral Systemic Health, with the goal of bringing the medical and dental communities together to help our patients. And it was there when my hygienist and I heard Brad Bale and Amy Doneen talk about prevention and heart disease. And what came across to me was how valuable dentistry is, that they can't do their job without having a dentist that understands the oral bacteria and what it does and knows how to treat it so that they can guarantee that their patient won't have a heart attack or stroke. So this is feeding into my oral systemic desire. It's helping me understand the value of saliva testing. And I also, at that time, was dating a cardiologist saying, oh my gosh, we are like right on the same page. Erica's got to come and hear these people talk.
She comes home with this, oh, you got to go hear Brad Bale, Amy Doneen talk. And I just heard him talk at this dental meeting, and it's sort of like the eye roll, you know, and I don't want to go to some dental meeting, you know. And I've actually told Brad Bale this before. I said, you know, she basically dragged me kicking and screaming to our first preceptorship, and he's shocked. He said, you didn't want to come hear all this great stuff? And I said, I thought it was a dental meeting, you know. So I didn't know. And back then, their dental component of what they were doing wasn't nearly as sophisticated as it is now. Right. And there's so much more scientific information behind everything they're presenting now. But yeah, I went to that very first preceptorship that we went to together, and I went back to, I was working in a small hospital system in southeastern Ohio, and I went back that next Monday, and I was talking to my partner, I did invasive cardiology, but not interventional. I didn't put stents in, and he's an interventional cardiologist, and I said, Joe, you got to go hear these guys talk. This is the best medical meeting I've ever been to. And because it really was. I mean, and as a cardiologist for 35 plus years now, I've been to a lot of meetings, and I tell you, this was the best, most eye-opening meeting I'd ever been to, because these two people had the vision to pick little pieces of information from here and here and here and put it all together and say, look, here's how we can stop heart attacks and strokes. We have to stop the inflammation. And I tell you, I was just thinking about this morning before we came here, and I think, you know, I am a board certified cardiologist, which means I took and passed the boards in internal medicine and then cardiovascular disease, and so my diploma says that I'm certified in cardiovascular disease. And I say, I don't do that anymore. Wow. I do cardiovascular prevention. I don't do disease anymore. Wow. Okay? So that's like, it was like this morning I said, wow.
That's pretty cool.
Yeah.
Now let's talk about your turning point, because, you know, I heard all that and I'm like, well, that's pretty special, but like, what did you grapple with as you went along that journey, internalizing? Like, let's get behind the mask. You're a surgeon doing work, and let's get behind that. Like, I get that you went from disease to prevention, but what did you have to do as a practitioner that was trained to focus in on symptoms and problems and end stage and deal with end stage disease? You just didn't. Maybe you did. Did you flip the switch? Tell me what happened. Give us that turning point.
It was you. So we were at a meeting and you were there, and I'd been to several more preceptorships, and I was still doing standard of care medicine, end stage disease cardiology, and working for the hospital system, and I was just getting more and more frustrated. I was seeing the same patients come back needing another stent, and they'd go home, and 3 years later they'd get another stent. And the hospital system saying, you got to see more patients. You got to, you know, the average cardiologist only spends 9 to 13 minutes with a patient. You've got, you got to see more people. We got to get more, people through here. And I said, I'm just getting frustrated with that, And maybe at a different stage in my life, maybe if I was 35 or 40 years old, that'd be okay. But after I've been doing this for 30 years, I'm tired of being forced to do it this way, like that. I want to be able to spend time with my patients. I want to get to know them as a person and instruct them on how they can really, not have that heart attack or stroke, so they can live that full life and spend time with just, the average age for a heart attack for a man is 65, for a woman is 72. So just when you get to that point in your life where you're going to kick back and relax and spend time with the kids and the grandkids and the great-grandchildren and travel, boom, you have a stroke and you're dragging your left side around for the rest of your life or something like that. So, and we don't have to do that anymore. So I'm thinking, I got to leave this. I can't do this. So it's either retire or I'm going to just totally shift gears, and Barbara and I are going to do this. And so we were at a meeting.
At Future of Healthcare.
Future Healthcare meeting with you, and I was the first person you called me, Eric, what are you going to do? What are you saying? I said, you know what? I'm going to leave the hospital and we're going to open a heart attack and stroke prevention center.
And that was the first time I heard that. We were talking about it, but he actually stood up and declared it, because until he was ready to leave the hospital, I mean, that wasn't in my bubble. He has to be committed to do that before I started with the journey of bringing the two of us together.
So she's over there sitting right next to me going, shut the front door.
Bravo.
So it's not that big a change for her, because she's still doing general dentistry,
right,
along with this oral, the oral systemic stuff. But for me, it's a total shift of gears. I was down, southeastern Ohio. I don't have any patients up here, starting from ground zero where I would start when I was 30 years old, and I'm not 30 anymore.
So what I'm hearing, guys, well, first of all, that's a cool journey, right? I mean, this should be a book too. It's going to be a documentary now, but this should be a book for sure. But let's get back to just recapping what you talked about. What I heard was, Steve, it's like, I hear that they can't unfry this egg. Right? Because this is an inside job first. So for anybody creating a medical dental model, it's like you have to have an inside out experience, right? Like, hey, I knew that there was a bigger game for me to play other than drilling, filling, and billing. Like, I can be in the game of health care instead of, sick care, and I could be doing much more work to have people live longer lives, right? That's like what was happening for you.
I didn't realize dentistry could save a life. That was that was the aha moment.
Yeah. Well, thanks for inviting us over your house last night. And then to see that engraved bottle that said, on a good day you save a smile, and on a great day you save a life. Thanks for a great day, because the place you were at, that you were touring, you actually saved a life that day.
I did. So we were on the Bourbon Trail a couple years ago, and we were at Woodford Reserve, and they had we were in the gift shop waiting for our tour to start. And I hear this loud bang, and this guy goes, "Paula, Paula!" And everybody turns around and looks, and this lady's on the floor seizing. And so we go over there, see what we can do to help, and she'd bitten her tongue, and she doesn't have a pulse, so I know what's going on now. And I asked the husband, I said, "Does your wife have any heart problems?" "Well, she just had a couple stents done a couple months ago." I said, "Okay." So we start doing CPR on her, and we call for an AED, and the manager clears out the gift shop. And everybody's mad at us because they can't go buy their shot glasses or whatever. and so Woodford Reserve, if you've ever been there, it's like in the middle of nowhere. It's a 25-minute ride for the squad to get from wherever they come from to Woodford Reserve. And so we're doing CPR this whole time. Her pulse comes back a little bit. We lose her pulse again. The AED had never shocked her. Barb, she'd bitten her tongue. Barb had instructed the husband on how to do mouth-to-mouth resuscitation, because obviously she'd bitten her tongue. We don't know what this person has, and we don't have any mask or anything there. And we finally get our rhythm back again, and the squad shows up, and she just as they're putting the EKG leads on her, and I want to, I'm anxious to see what's going on in there. She wakes up. She'd been unconscious the whole time. She wakes up, she's been hypoxic, she's combative, she's flailing around. They can't get an EKG. And I said, "Just hold still a minute, I want to see what's going on." Darn it. Anyway, I got a call from the emergency room a couple hours later, and they were asking me questions about what happened. And I said, "What's going on?" "She's doing fine. We're going to cath her again tomorrow and see what's going on with those stents, blah, blah, blah." And and she did fine as far as I know. And so the manager comes over and gives us hands me a bag. He says, "A little gift for you. Thank you very much. You can open it now or open it later." And I said, "Okay, I just took it out to the car with us." And we get out to the car, and well, you know what the story was.
That's a long story.
It is a long story.
But
Okay.
that was engraved. They went to our website while we were on the tour and saw that we had, on a good day you save a smile, on a great day we save a life. And they had that printed on the bottle for us and said, "Thanks for a great day." So.
Well, now you're in the life-saving business, okay? So there you go, right? It's really real. So as a dentist, you're in the life-saving business. You went from, gum gardener, tooth mechanic, right, to, a lifesaver and a life extender. So like having that high purpose, you can't unfry that. You can't not look at inflammation at this point. You can't look at the airway. You don't see those things the same way, right? So when you have that place, now we're coming together. Now how do we do this? So tell us about like the beginnings of the building of this office and that part.
Well, I was moving a half a mile from my previous dental office into a new space, trying to find a space that had an elevator, because we knew we might be bringing in some elderly, sick people, and a lot of the buildings here don't have elevators, so that was one of our hurdles. But we basically put together a 5-op dental practice, and then Eric has a consult room and a medical exam room. They are plumbed for dental chairs in the future. If when we leave, we don't have successors to follow us, it can be sold as a dental practice. And they can get 2 more chairs in. So we thought that forward. I thought was a pretty good suggestion for us. So we figured out our layout, not knowing how we were going to run the business. So you make decisions and then you kind of fall into whatever pattern you build. But our biggest challenge, if we were going to start referring patients back and forth to each other, is we don't have a software that talks to each other. We have the medical records and we have the dental software. And so when we're trying to communicate, everything has to be done double, everything has to be scanned in. If we're seeing, the health histories aren't even in the same place. So we had to just come up with systems on how we were going to work day to day, and how we were going to start having the conversations with our patients of what we're doing. Now, my patients have heard about saliva testing, and we've talked oral systemic, so we've been dripping on our patients for 4 or 5 years. Now they're walking into a heart attack and stroke prevention center with a dentist inside, still trying to figure out how that fits together. But we have something called the root cause tree in every operatory. So when we are doing our periodontal charting and talking about periodontal disease and doing our saliva tests, then we bring the story together of the problem. You have periodontal disease and you have high blood pressure and you have high cholesterol, and we're putting the story of their health history together. And the consequence is if we don't treat this, it can go on to not just advanced gum and bone disease, but it can go on to a heart attack and stroke. And it's a different conversation at the chair, but we've been taking baby steps over, because we found if you come at our patients with too much, and they've never heard this before, they're overwhelmed, and we've lost some patients because we're putting too much on them at one time.
For someone looking to build a medical dental practice, you want to go to the lowest hanging fruit. So this is what we learned. This is one of the 9,099 ways not to do it, and this is the one way to do it. You go after the somebody who has already bought into prevention, which is a functional medical doctor, functional doctor. DOs are great. Nurse practitioners are also possibilities, like Amy Doneen was. So go after people that are like a nurse practitioner that elevates his or her game, or someone who's already in the realm of prevention, thinking that way, right? Where, you know, like it's sort of like, why build an electric car? Because that's going to get rid of like fossil fuels, and so it bumps into all that stuff. You know, you speak to a cardiologist, it's like, that's how I generate my income, through end-stage disease, and it's like, it's a whole paradigm shift to do that. So it takes too long. The easiest way to do it is to nurse practitioner elevates a nurse practitioner's game, and they love it. They feel honored and respected, and that's really what they deserve, because they can do great work. And then the functional medicine DO. So when it's built on a dental chassis, that's why we believe dentistry is the catalyst for bringing medicine and dentistry together. Not the medical doctor, it's the dental doctor. And here's why. Even retailers are looking at dentists as their future. Why? Because they have reoccurring, every 6 months, every 3-4 months, reoccurring business. That creates traffic. When you have traffic, that will generate for the medical side of the work you're doing. But just like you said, Barb, you're going to bump into stuff because the expectation is, I'm here for a cleaning, not for you to save my life. So there's systems that we created. Again, the 9,999 ways not to do this were all the gifts of the systems that we keep cleaning up and clearing the brush. You guys are called frontiersmen and women. You clear the brush. What we're doing is creating the system with the brush clearing, and then the pioneers pave the road, and then the settlers go, this is the way it was always done. That's the 3-step process of bringing things into the world. So now you're clearing brush. And what we now know is, okay, now you got somebody that's a partner. It's built on a dental chassis, which is what we want, because there's reoccurring business. The patient comes back through hygiene. Then you escalate the education, and you have to do what we call the 4 Ps. So I'm just going to highlight the 4 Ps that we've been working on. First P is, this is our position. So you have to reposition who you are on that dental chassis to move them from here to here. And our position is, we're a complete health practitioner, meaning we don't just look in the mouth, we look at your whole body. Now they can go, oh, okay, the pleasing benefit. The benefit to you is we don't only just make sure you don't have any pain or it makes it look good, but we can also extend and help your life be healthy. I see in your medical history form you have heart disease in your family. We can address that in the mouth. Did you know that? Right? No, I didn't know that. And now anytime someone gives you something that you didn't know about, you're like indebted to them. There's like that was a gift. And then the third P is the proof story. So then you have these conversations that you've been developing of people's lives, just like the one that you saved at the Bourbon Trail. And then you have many, many, many that you have now of people, your proof story. May I share about a patient that, whose life is completely changed because she came in here for a cleaning, we identified this, and now we have this. And now she sees Eric. Do I have your permission to work with you that way? Or would you like to have us just treat you, come in for your cleanings, and just treat you for your oral health? And then you ask permission. And so then the people that want to stay there, but you planted that seed. For the people that don't, Now you're not losing patients, because you were losing patients, right? And just because we didn't develop that 4P system, and now you have that, right? And so these are all the brush clearing that you've gifted everyone else.
It is hard, you know. You don't know what you don't know, and then when you know, you want to give it to everybody. Not everybody's ready to receive it, and I have to be okay with that. But I also know I don't want to do periodontal therapy if I don't know what bacteria is in your mouth, because I know what that can do. It's almost like me doing dentistry without my loupes. Yeah. Like I don't have all the information, and that's a little scary when you know, and somebody doesn't want to accept that type of care.
Well, one of the things we know about the psychology of a patient, you give them what they want first, and then you give them what they need, right? And there's a way to bridge that. It's the want and need, right? So often we're not ready to hear. How often do you go like, well, you've had, my family had heart disease, and the family before that had heart disease, and then you're like, well, how are you looking at it? Are you looking at yourself? No, they're just in denial about it. So you have to, gradiently bring the patient up. We believe, so step number 1 is have a dental chassis. Step number 2, attract a practitioner that gets benefit from who you are as a dental practice. Concierge medicine, functional, DO, or nurse practitioner is the ideal. And now, once you have that dental chassis, the patient education system to transition them to the medical side. So now we're building off of that. So now you're here. Now what's the new set of challenges that you have? So now we overcame that challenge. Now what's next? What did you see next in the process of your journey?
I would say, as through education, we're telling what's possible, and the patient will say, let me go and ask my doctor about this, and I'll get back with you.
See ya.
And so there's not the medical professionals out there to endorse and support us, because they don't know what they don't know.
Right.
So that's a frustration and a hurdle that we have to make it very personal, and hopefully through our passion and our knowledge and research, they learn their story.
Right, and so there's they're looking for the validation not coming from you, but from someone that has looked at history, and so the devil they know is better than the one that they don't, and now you're sitting and you're giving them a new pathway, and it's hard for that to happen. And so there's a conversation that you can have with them and let them know that you respect that person, and not everyone practices the next generation of medicine, working from treating the disease symptomatically to preventing it before it happens. So they may or may not understand what I just gave you. And then you want to be able to, would you like to have a book or learn more about the science behind it? Because there's 4 types of patients. There's the competitive, they don't need details, they just want to know how you're going to prevent a heart attack. There's the methodical person who needs the details, and that person is going to go to research, like you said, they're going to go do the research. That one patient, we can't say that that's all patients, that's one patient. Then the humanist wants to know, how does this affect my relationship with my family? Oh, you're going to help me live longer? Oh, that's important. And then the spontaneous can't really pay attention to you anyway, because they're just like squirrel, 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 and they're having fun. But most spontaneous people are just kind of rolling along, and they just go through life like that. But we had to design something, and we still have to design, because this is still being unfolded, that specific methodical person that they source from the new thinking. Because that's another hole we need to plug in the brush clearing, right, as we go. So that's perfect. So we've talked about how to build a medical dental practice on the chassis. When I say chassis, it's like on a car, it's it's the foundation, right? And so in your practice, we went to work on that and strengthen that. So the 3 areas we look at is case acceptance and patient retention, because that's really the structure. When you can do that well, then you can translate that over to the medical side. So we started in 2016 really tracking, we've been together for a long time, but really I'm just pulling numbers up just to give you a sense. Before 2016, didn't really track treatment presented and accepted, right? Right. And in May of this year, I just pulled May stats, which was really interesting. You presented 188,000 and got 106 accepted, for a 57% case acceptance ratio. That's pretty extraordinary. That's congratulations. And what would you attribute that to? How did that happen? How did you get that level of presentation and I
think it's the team buying in on what we're doing and how their work matters. And it's not just what I'm doing, but really the oral systemic connection and treatment is a lot of the hygiene program. And when you have people that are tired of cleaning teeth all the time and are searching for something more and really care about their patients, I just feel I have a great team that has really engaged and have educated themselves on the oral systemic connection, and it's just starting to flow, and we just get better, and we're learning how different personalities, like you said, how to receive it and how to come from their place. And it's just what works and what doesn't work, and talking about it and maybe redirecting another way when they come back in, and good notes of what their takeaway, what their perception of the patient was, so we know where to pick up when they come back.
Yeah, hygiene's the engine here for retention and case acceptance and dental assistance as well. And Laura and Patty are at the top of their class, and they understand the oral systemic connection, and they are drivers for this with you. And so often a doctor will say to me, I'm a complete health practitioner, I believe in oral systemic health, and I'm like, well, what do you say to the patient when you meet them? And they'll say, what's hurting, anything bothering you? So they're like focused in on symptoms. Right, Steve? And then that's like game over right at that point. And they say, well, I am, but my hygienists aren't. It's a big prophy mill. They're just like doing bloody prophies. And then, they're living in that world, but they want to create an oral systemic practice. And that's why, your statistics, when you elevated and started talking about whole body health, it impacts the day-to-day numbers that run a successful dental practice. And when I look at your case acceptance, to go from like not being tracked to that is incredible. And then your hygiene numbers are incredible. You weren't tracking hygiene in 2016 February, and then in May of 2019, you presented 26,000 in dentistry and closed $12,000 in care. And so that's like, very, very solid numbers in terms of your impact on, we always use numbers as the impact for how healthy you're getting your patients, and that's quite extraordinary.
And some of that is the testing, and the products that we use also help the bottom line, which is not insurance driven. So those help supplement those numbers.
You're great. And then when I looked at your RIA points, what we found is when a patient leaves without an appointment, that is the cascade that affects the revenue in a practice like 6 months and a day prior. Most people are looking at the revenue like, what's it there today? Like, what's my production and collection today, if we're lucky, or what's my bank account is probably more. But that bank account is affected by the business model or chassis that you're running. And you went from 60% pre-appoint after hygiene to 92%. We
really focused on that particular piece by using the dashboard, and I mean, it's so easy. We just have to pre-appoint when we changed it from being back in hygiene to up at the front desk when they checked in. And in the huddle, we'd talk about if it was a 3-month, 4-month, or 6-month recare. And so they would know how to pre-appoint when they checked in for their next appointment, unless we were going to change something that would be more of the norm. And we just focused on it, and we were just watching it go, and it just shows if you just focus on it, the change you can make.
Yeah, and you'll see this graph here that will show it's like the turning point was right in 2017. Like 2016, you really got to work, and in 2017, you were in the red almost every month in practice total patient growth. And 2017, ever since then, you've been in positive growth in your patient base. So it's because your purpose is high, your processes are tight, right? Your performance and your indicators you have your eye on, and you have the right people in the right places doing the right things, right? So when you get that sweet spot, now you have platforms to measure. You talked about having analytics and a dashboard. We're going to talk about the automated marketing system that you're using to get your message out, right? Platforms are key. So those are the 4 pillars that you've used: purpose, people, process, and platforms. And when those 4 things come together, now all of a sudden you have a business model that you're delivering. So, and then just your net patient mount is just incredible. So a strong chassis of a healthy dental practice is what you've created, and you're going to grow a couple $100,000 this year. Congratulations. And that's really amazing. So you're building this dental practice. Now we're building this medical dental practice. Let's begin to just unfold this part of the business. So now we have people coming over to you, Eric. Let's talk about what are your struggles? What have you bumped into? What are you dealing with? What have you noticed? Let's talk about that.
Well, I think the hardest part is education of the public and the medical community in general. I mean, I know that I had somebody who I talked to about that really needed my help, and he went back and talked to his cardiologist. Oh, I know what Eric's doing. You don't need that, which is amazing because that person's just waiting for the next event to happen. He's going to take care of it if the patient survives. So that's one of the big things I think is education and I don't know that we're going to be able to educate the medical community enough. They've been doing the same thing. They're doing it their way, and this is what we do, and they're not bought in. I mean, we all, and the government and insurance all pays lip service to prevention, but nobody really does it. Oh yeah, you need your mammogram, you need your colonoscopy, you need your PSA checked, but that's it. Nobody really cares about looking for that mild asymptomatic disease, which is just the kind of plaque that's going to cause a heart attack or stroke. They're only interested in doing the stress test that's going to find the blockage that needs a stent or bypass.
So let's talk about the process. So when a patient comes in, just lay out the process simply for us. They come in, we have a starting point, right? That was the first thing we learned, right? We don't want to give them the whole thing because it's overwhelming. So let's talk about the first step.
So the first step is a patient who's referred in who says, I don't know if I want this or not, or if this is right for me. My dentist, maybe it's Barb, maybe it's somebody else, says they saw something on a cone beam, or they saw something on my Panorex, so I want to get a CIMT. A CIMT is a carotid intima media thickness test. It's an ultrasound test, not like the one you get down to the hospital or those scanning services. Those are Doppler tests looking at flow through the artery. We're actually looking at the wall of the artery to see if there's evidence of early disease. And if there is, then we can prevent you from getting into trouble. So that's the first step. And I think that when we get that report back and I show people their images and say, look, you've got this plaque in your carotid artery right here, and that says you've got disease elsewhere too. Right. And I think that's like, like they say, a picture's worth 1,000 words. When you see that arterial, I know when I first saw my plaque, because I got my dad's genes, I said, holy mackerel, I'm going to die. And I said, no, wait a minute, no, I'm not. We can stop this.
Exactly. So now you have them come in. Now you're going to go all root cause. You do lab work, right? And then you present to them what their situation is, right?
We go through a whole slideshow. Here's all your lab work. What does this mean? What does this mean? What does this mean? And then the plan. What are we going to do? What's the best way to handle this? There's maybe a couple of prescription medications and a handful of supplements, and lifestyle. I mean, that's a huge part of it, is lifestyle. You can't sit on the sofa and eat McDonald's every day, okay? You've got to, it's like the Life cereal commercial, you can't be Mikey every day and, eating Life cereal. You got to grow up sometime.
I think what our patients like is, because you also do the genetic piece, that you're doing personalized care for that particular person. They're just not part of that bell-shaped curve. You are guiding and giving them advice based on them. Right.
One of the big genetic pieces is that what do we recommend for you diet-wise? Because everybody says, oh well, the Mediterranean diet or the keto diet or whatever it is, and that diet may not be right for everybody based on your genetics.
It's great, and so it's super customized. And here's one of the challenges that I know you guys have faced is just like the challenge of getting a medical doctor, you go after the low-hanging fruit, the people that are going to be willing. Don't go after the non-willing person. So now we have to market, right? And you guys are not speakers, right? So you're not trained speakers. So we got to market this practice. What the heck are we going to do? And I say to you, what? We're going to have you do webinars to patients. And you're like, what? What do I wear? How do I say it? What do I do? Just like today, right? And it's like, what? Because that's a whole different, having a live conversation and having it videotaped is one thing, but delivering like a newscaster is a completely different context.
So I'm early on, when we just started this whole thing, Barb, we're doing some talk somewhere, and I said,
I don't know how to make a slide.
And I'm looking at Barb and says, what have you gotten me into? I don't do public speaking.
Right. But so now, practitioner to speaker to, engager, marketer, no. So you need a platform. So we created you created this platform to have webinars go out to patients of other dental practices, so you add value for those dental practices because you're the experts, right? So there's this whole marketing system that's all automated, and then you show up for an hour and deliver this powerful message. And so what was that like for you when you did that? What happened?
It was actually way easier to do than I thought it was going to be. Yeah, I actually had some fun doing it, and I enjoyed it. I thought it wasn't nearly as scary as I thought it was going to be.
Yeah, yeah, and it's harder when you don't have an audience, so you're that you can
Really
see.
hard
I
to
thought it was
talk,
harder
right?
for me because I feed off people.
Yeah,
and
you
I'm
feel
talking
it.
to
Yeah.
and I'm talking to a screen.
It's
and
hard to look at a camera.
And I
on a
don't know how
computer.
I'm being received.
Exactly.
So I found it challenging.
Yeah, and you're a methodical thinker, so you have to have it all figured out before you do it, right? And it has to be like steps, and you and the 90% of dentists think that way, and MDs. So you step down the court, and then you enrolled patients from that, and your reach is much bigger. And then you found you can reach other audiences that are low-hanging fruit, like Juice Plus, for instance. Like that group of people are into prevention, and now you're experts speaking on prevention there, and now they're interested because they've already bought into that you can prevent disease, chronic disease. And so you're doing webinars for them, right? So that, and you spend an hour, and you're done. And you go home, but your reach is big. So marketing for a medical dental practice to the right audiences via web marketing, using a platform to deliver that social media marketing and the emails and stuff like that, having that all systematized is really key. And then you get to show up and deliver it, right?
You can see our age, right? So this is not our forte.
Well, that's why we designed this marketing delivery system, because our average age is 55. They hate technology and hate marketing and hate speaking in public, right?
That's us.
And then now look at you, you're sitting there and you're like having fun with it, right? So when you take away and you actually step on, now you got this voice. So there's other places that you go. So the big one is other dental practices. So you're visiting as a gift, adding value to the practitioners in these offices, elevating a hygienist to a hygienist. Right? Elevating an assistant to, no, I'm not just an assistant, right? They feel bigger, better, they have more purpose, right? So that's pretty cool.
That's really been empowering. I mean, just to watch people's aha moment and then getting the feedback from the dentist saying, wow, you made such an impact on our team. I mean, they're like all excited about trying some of these new things. Thank you, thank you. And it was like, I didn't think we did that much, but the feedback was amazing.
That's a big deal.
Oh, absolutely. Yeah, we've talked quite a bit, but the mindset of the average dental / practice owner, practitioner is where you were. And it's interesting that now, you probably don't even fully realize or appreciate how far you've come, because this is your normal now. And that's who we're speaking to today, is now it's a new normal for them too.
Yeah.
So, yeah, it's very cool. It's a very cool journey.
Yeah.
It's
A very terrifying, cool journey. Go ahead and say it.
well,
And it is okay to say that,
and I tell my children, I said, here we are when we should be retiring, starting a whole new business, and we are learning every single day new things and how that excites us, and as a role model that, life is a journey and you just keep learning new things. I mean, I can't imagine retiring, and being in my garden would be nice for a few weeks, but this has really energized us and stimulated us.
And that's where I was before we started this practice. I'm either going to retire or we're going to do this. And it's like, I know I really said I really can't retire because I got golf, I got a little photography. I'm no darn good at golf. A little photography, I got a motorcycle I ride, but I can't do that all day long.
We call it rewirement, Eric. Rewirement.
Right, that's all.
And not retirement, because look, the 60 is the new 40. This has enlivened you. I mean, lost weight, health, your own. It just gives vitality to who you are, and you're speaking at that, right? And it's rewirement is this: retire from the things you're not good at, retire from the things you don't like doing, and retire from people that suck the energy out of you. And so, you're creating an environment here and attracting people that are empowering you, supporting you. You're not doing the things that you don't do. You're delegating that. We're automating things so you don't have to worry about it. And then we can move into finances, because finance underneath it all, it has to work, because if the money ain't right, you can't be in the fight for ending cardiovascular disease. We had this conversation that I think was very profound, where we identified, and Steve, in the patient enrollment process, there were some gaps, right? So the new patients were coming in, but we found that we had to fix the system for what should we offer them first. We fixed that. Now we have, like when they meet Eric, we have to look at, and this is all numeric, this is all measures, and we're looking at all these numbers. The conversion rate from the phone call to coming in, we found was at what? It was 20% when we first started. So we're getting 10 calls, but we're only getting 2 people to convert. We had to clean that up, right? So that's first cleanup. Then when they came in, then now we have to look at Eric, and Eric was like, this was an aha moment, I would think, right?
I learned that I was just not conveying my emotions enough to the patients that that they really do have a problem, and what the consequence of that problem is going to be, and we can fix it, and we can take care of it, and they need to understand that having a heart attack is optional. I'm not going to let you go walking around like a ticking time bomb and say, no, you can't do that. You've got to come in here and do this.
Right. And what was in your mind? Let's unfold that thinking. Because you had to transform, you had to unlearn something and relearn something. Let's unpack that a little bit, because I know there's a lot of practitioners, dentists, doctors living in this world right here.
Well, part of the problem is going from a fee-for-service, working for a hospital system, to being on your own. I'm not worried. I mean, I would see people, and Medicare pays $35 for an office visit or whatever, and I'm thinking, I can't charge them this much. I'm not worth that much, but it's their life.
Yes.
It's their life, and they need to understand that the insurance industry and Medicare are really not interested in your health. They're interested in making money, right? For Medicare, the ultimate cost saving is when you die, because you paid in all these years. Now you're not. Right. But the insurance industry, they've got a business. They're making money. They're not really looking out for you.
Right.
They tell you they are.
That's right. So what I'm hearing is that you didn't have to deal with money before. You came in and just did your stuff, and you'd get a number, and that's like you were just trained, like that's your muscle memory. Now you're a business owner, and you're providing value, and you had to shift something. Something had to shift, and you had to be the stand. You're not selling what you're doing. You're a stand for that patient. And so how did you shift when you saw what was there? What was it like before you knew this, and now how are you being now? How is your beingness around when you see a situation?
It's a work in progress.
I get it.
I'm still working on it. I feel like what I don't want to do is I don't want to be selling something. I really don't want to be selling something. And I think that the patient needs to understand how serious this issue is.
Yeah.
And that the standard of care is not finding that early disease process that we found in this patient, and that we can do something about it.
Yeah.
You've got to trust me that we can make this go away.
Yeah.
We can stop this whole process.
Yep. Steve, one of the things that I see when I work with practitioners, it's so innate, and they're so giving and loving. Just that mindset, just to get into healthcare, is natural. And then what happens is, it's like you think you're a bearer of bad news, or you own the problem, not their problem. And then really not, because it's so innate to you, you're a healer, both of you. You go, I shouldn't have to charge for it. It just became like this melted down thing. What is the value of spending 20, 30 years event-free with a 55-year-old who wants to see his son graduate from high school, college, and become a sportscaster and travel around the world with his wife? If you told me, how much should I pay for not having what my father and my mother have? Mm-hmm. Dementia and cardiovascular disease, stroke, stents, I would pay anything for that. But that's the paradigm shift that a person coming from insurance-based, hospital-based thinking to a new stand for something. And I know that that's not a natural. It's going to be a work in progress. and we'll get there. But thank you for being like real about that, because so many practitioners live in that world, especially somebody like you that came from the hospital system to a private system. So we'll get there. It's a process, but at least you're aware of it. So when you're aware chairside, bedside, you can catch yourself, right? And that's the first step in transforming that. So Steve, I mean, pretty incredible, right?
It really is astonishing what you guys have done.
I mean, you're a business guy, you're a trend analyst, you know what's going on in the industry, and you know this is the future of dentistry right here.
Yes. Yeah.
And the future of healthcare right here, right? So, I think it's really important, like all these struggles, all this journey. Let's talk about patients now. What kind of impact has this had on your dental practice alone? And then we'll talk about how the Heart Attack and Stroke Prevention Center has like changed or saved a person's life. So Barb, for you.
Well, a new patient walking into the center, into a heart attack and stroke prevention center, I think if they don't know what we do, it's kind of looking like, am I in the right place? The patients that have been patients of mine over the years have gradually been dripped upon on the oral systemic connection. We've been gradually educating them, and when we meet people where they are, and then we try to take them to the next level, and as long as they're asking questions, we know that they're interested. And I just happen to have a 70-year-old farmer that's been a wonderful patient of mine over the last 3 years. The first time he walked in, he didn't have a lot of value for his dentistry. He's a very hard worker. I know he makes a good living, but time is essence, and the crops and the weather always get in the way. So he would cancel at times, and I just understood it. And he just would say, I'm very cheap. I don't need the fanciest, I just need my teeth to work. And that was probably our first conversation. Then we started educating him on periodontal disease, and we did a cone beam, and we realized that he had calcifications in the carotid arteries. So I started talking his health history and his periodontal disease regarding, you have cardiovascular disease. I can see it on the film, and we get all of our cone beams read by a radiologist. So it's in, the report is there in black and white, and I kind of suggest possibly having a CMT with Eric. I don't need any of that stuff. I don't need any stuff. But he's been gradually doing his crown work and coming in more routinely for his periodontal therapy. And I seated 2 crowns for him yesterday, and he asked me if I had a few minutes of my time that he wanted to talk with me. And so I said, sure. I said, give me a few minutes to finish up. And I came back, and he said, I've been thinking about what you've been telling me. I really now am starting to understand the health of the mouth and the health of my heart. And he says, we have grandchildren, and I'm really starting to realize, I thought I didn't care if I died early, but now that my children and grandchildren are starting to grow up, I still want to be here longer. So I need a little bit more information on what your husband does. And, could I talk with him and learn a little bit more? Because I think I want a quality of life better. And he says, but I'm frugal. And I said, well, we all know that we want to live a quality life like this and then go down. We don't want that gradual, decline, because we want quality of life for our health. And I said, your wife is a financial planner, and we all plan for finances, but we can also plan for our health and know that, by being preventative, we can improve the chances of a quality of life. And he says, I think I'm going to talk with my wife a little bit more, and I think I'm ready. And I mean, he teared, I teared, and that was a day why I do what I do, because I did make a difference. I do know he has active cardiovascular disease, and he needed to do a couple implants. He was asking me about implants, and I just said, John, let's put the implants on hold. And let's use that money that you're going to put in for your implants, and let's see where you are with Dr. Goulder.
It's a great story, and now he's on the path, and now he's ready to go. And see, what I heard was he was buying function before. He wasn't buying aesthetics, right? He wasn't buying all. He was just buying.
Nothing fancy.
Nothing fancy. Want him to work. I got him working. I'm chewing. But then he bought the emotional longevity of being around for his family. you are in the longevity business. You're not in the teeth and gums business or even the heart business. You're in the longevity business that provides people time to experience life the way they want to experience it in a productive, healthy way. So that is invaluable to him. At 70 years old, he gets to see his grandkids. Yep. And then let's get Eric here.
So this gentleman's a 75-ish-year-old gentleman who he'd already had his aortic valve replaced. He'd already had open heart surgery for that. He'd had some bypasses done. And he had significant carotid disease. And he found us, I'm not even sure how he found us, maybe through the website. But he knew that, and he'd been up to the Cleveland Clinic.
Somebody gave him the book.
Yeah. He'd been up to the Cleveland Clinic, and he was all over the Esselstyn diet, which is a very low fat and vegan diet. He's exercising, he's trying to do everything he can, but he goes up to the Cleveland Clinic and they say, oh yeah, you've got a 60% blockage up here in your carotid artery, and come back, but you're not having any symptoms now. He had a couple of TIAs mini strokes a few years earlier, and he said, come back when you're having more symptoms. And he comes in to see me the first day. He says, I went to the Cleveland Clinic and they told me to come back when I'm starting to have a stroke. I said, that's not right. I can't do that. So we, totally evaluated him. And I mean, he was doing a lot right. He had a lot of dental issues that Barb worked on. He actually had a couple of root canal abscesses that needed to be taken care of. And his inflammation settled down after that. And yeah, he's doing great now. So that's it's just a matter of figuring out what is driving the inflammation,
Right.
And we can help a lot of people.
That's great.
So yeah, so what we need to do is get 20,000 Barbs out there. We need 20,000 dentists doing oral systemic dentistry that to join us to get the world healthy, to get this country healthy, because we can totally prevent heart attacks and strokes.
Yeah. Now, how you can help the dental industry because of the move you've made. So, what are some of the things that you can do to help dentists?
Well, I mean, we treat a lot of dentists. We see a lot of dentists as patients. But I mean, if they want to come in and follow us around for the day, we can do that. If you've got, one of the hard things that, whenever we get together with, and it doesn't matter what group it is, we're in several different groups of like-minded people, and it always gets us juiced up. And these meetings happen usually once a year, so we keep getting recharged. But everybody's got the same problem. You've got, Bale-Deneen physicians, preventive physicians who can't find a dentist to work with. You've got, oral systemic, complete health dentists who can't find a MD or DO that gets it. And so maybe we can help you make those connections. So if you're having problems finding somebody, give us a call.
This brings up for me my favorite quote, and it's by Margaret Mead. And she said, never doubt that a small group of thoughtful, committed citizens could ever change the world. Indeed, it's the only thing that ever has. And you're the small group of thoughtful, committed citizens. Gaining traction very quickly. So thank you for allowing us to be here today.
Thank you for this opportunity.
Yeah, and thank you for doing what you've done and to establish a brand new norm for what's possible in healthcare.
Yeah. I think 20 years from now, we're all going to be doing this.
Absolutely.
Just be normal. And just be how it works.
Thank you.
Thank you.